So today is about where we are and where we're going in the Medicare Advantage program, but it's important to recognize where we came from. For me, that first tour at CMS in the Medicare Modernization Act days, Medicare Advantage only had about 18% of the eligible beneficiaries enrolled at that time. And one of the old timers, when I was working there, pulled me aside and he said, "Kid, I think you could make something of yourself at CMS, but you better go work on the physician fee schedule or something that's important, because this plan stuff doesn't matter much here." Well, that guy turned out to be really wrong. Here we are, and Medicare Advantage is a driving force in the Medicare program, a driving force for innovation, a driving force for more coverage for beneficiaries. And 54% of eligibles are now enrolled in the program. But we certainly have some challenges right now, starting with the funding challenges posed by version 28 of the risk adjustment model, some of the challenges that we've seen in STARS, and then ongoing pressures in utilization costs, both on the utilization side and on the unit cost side. Those collective challenges have certainly impacted the benefits that are rolling out today as AEP begins for 2026. And as we've analyzed landscape files, we've come up with some insights on what we're seeing from those challenges. And Robin's going to take it over from here and walk through a couple of the slides that we put together. Robin, all yours.
Awesome. Thank you, Mark, and hello, everyone. So you might imagine there is a tremendous amount of data in the landscape files, and we have relatively little time. So I'm going to be zooming through some slides here, but please do come find us later if you have more detailed questions. We love to chat landscape files. Let me see if I can advance. Here we go. So just starting at the national level with a very quick snapshot. So as we look from 2025 to 2026, overall, we're seeing a very small decrease in the number of plans, about 1% or 54 plans. Now, where, to me at least, that starts to get really interesting is where we look at the difference between what's happening with individual plans and what's happening with special needs plans. So if you see the orange here at the top, that's what we're seeing around individual plans. So that's a 9% decrease, right? So that's driving a lot of that overall decrease in the number of plans. That's consistent with what we were seeing from 2024 into 2025, by the way. So that's a bit of a continuation of a trend. The thing to note here, though, is if you look at the bottom, at the dark blue, and I know it's a little hard to see probably on these from the audience, but that are the special needs plans. And there we're seeing a nearly 20% increase in the number of plan offerings. So as folks likely know, the majority of those are and continue to be D-SNPs, special needs plans for the dually eligible, but we're really starting to see an uptick in the number of C-SNPs, so special needs plans for those with chronic illnesses and disabilities. So that's something that's really been grabbing our attention as we think about what is access going to look like for beneficiaries heading into 2026. So that's our top line. From here, I'm going to talk a little bit more at the state level around what we're seeing, both overall across all plans, and then breaking it up like this, right? So looking at individual plans and then special needs plans. From there, talk a little bit about what we're seeing around maximum out-of-pocket limits and also around premiums. As a quick reminder, this is what we know so far about how 2026 is shaping up. We will be getting additional data that will help us to dig in a bit more on the plan benefit package side, sort of understand how specific plans are shifting their benefit designs and strategies year over year. We are, as you might imagine, eagerly anticipating that additional release of data, but so far, some of these give us some of that bigger picture idea of what we're looking at going into 2026. Okay. Let me see if I can advance here. Okay. So here is the map if we look at, again, that overall plan count, right? So here we're looking at both individual and special needs plans. Perhaps a little hard to see, but I think a key thing to pay attention to here are the colors. So if you look at these blues, all the states that are in blue, that's where we're seeing a decrease in the overall number of plans. The darker the blue, the bigger the increase, right? So if you look at, for example, Vermont, New Hampshire, we're looking at 30% or more decrease, right? On the other side, if you see these orange states, that's where we're seeing increases overall in the number of plans. So the darker the orange, the bigger the increase. So if you're looking, for example, Texas, Oklahoma, a more than 10% increase in the number of plans. So, as we switch from that bar chart over to a map, you start to really see tremendous amount of variation as we look across the country. And of course, we're showing it here at the state level, but important to keep in mind, we see that variation, right, even at the county level in terms of what's happening. There's a much more granular story to tell here as you get into that county level data. And also as we think about that from a beneficiary point of view, you're in some counties where perhaps you've gone from, say, 30 plans to 20 plans, so there's still quite a number of options. In other counties, that change could be a bit more dramatic, right, where you were looking at having perhaps 7 plans and you've gone down to 2 or 3. So there's quite a varied story from that beneficiary choice perspective, depending on where you are in the country. So to split up here a little bit, here is the individual plans as we look across the country. Again, the blue is where we're seeing the decreases, mostly decreases here. The orange are the increases. So overall, 33 of the states are where we're going to see a decrease in the total number of individual plans. So, doing that math there, that's about 14 states where we see an increase. Keeping in mind here, though it's a little bit variation in magnitude of decrease, some similarities here. Again, if you're looking Texas, Oklahoma, New Mexico, that's where we're seeing some of those increases. Again, if you look up Vermont, New Hampshire, where we're seeing some of those larger decreases. I'm gonna switch, too far. Going to switch over here to looking at special needs plans. So a bit of a different map as we would expect. A lot of orange here. And that's where we're seeing the increases, the growth of special needs plans. And so again, we're looking at a state level here. Still a tremendous amount of variation at the county level, particularly if we're thinking about C-SNPs. That's going to be a bit of a varied picture across the country. But, I think there is, a notable uptick here. And as we think about, sort of plan strategy and, beneficiary choice, really differences from looking at 2026 and what we're expecting from, say, several, early 2020s in terms of access to special needs plans. Okay. Here we're going to pivot a little bit and look at, sort of away from, straight plan counts and a little bit into a preview of how some of the design is working out. So here we're looking at median maximum out-of-pocket limits. And we're looking at here for individual plans because, that's where it is most relevant. So as you can see here over on the left, we have 2022. So not too long ago, we're coming in at that median around 5,300. We saw that tick down for 2023 and 2024 around 5,000. Then a jump in 2025 up to 5,400. And an increase again in 2026, we're seeing that median, again, if we look across the country at around 5,900. So some real changes there in terms of where that median is landing. Of course, a chart like this masking, again, a true amount of variation, at the state and county level, but a little bit of an indicator of, sort of a trend on, that cost, that beneficiary out-of-pocket side that caught our eye as we were reviewing the landscape files. So just kind of give you a little bit of another data point here. That's about, for 2026, 45% of plans coming at a MOOP of $6,000 or above. So that's compared to about 36% for 2025. So a bit of a shift there. Move us along here to take a look at premiums. So here we have premiums broken out by individual and special needs plans. I'm just going to tell you overall, so not pictured on this chart, but just to keep in mind, 59% of plan offerings are $0 premium plans. So we're still expecting for 2026 a landscape where the majority of beneficiaries are going to have an option that is a $0 premium plan. Now, of course, some variation there. Here, so, again, if we look at the individual side, again, that's the higher side on the left here. For 2026, we're expecting about 70% of plan offerings to be $0 premium plans. It's 1% increase it's 1 percentage point increase rather from 2025, around 69%. So some stability there, although of course here, as you can see, fewer plans overall on that individual side. A note here that for plans that do have a premium, right, so if we're thinking about $0 premium plans, it's going to be an option for a lot of beneficiaries, but of course there are choices that do have premiums. There we're also seeing, if we look at the average premium, a small decrease from 2026 to 2020, or rather from 2025 to 2026 in premium amount. So a change from $46.64 in 2025, rather in 2026, down from $49.41 in 2025. So again, a little bit of an indicator on the affordability side. And then just to quickly show you, want to give you kind of a snapshot as we look across the country at how some of the availability of those $0 premium plans are shaking out. As we know that's often a key area of focus as we think about what kind of options beneficiaries have. So just looking here at percent change in the number of $0 premium plans available. Again, so we are seeing, despite, sort of that majority of beneficiaries having access to one, there are decreases in the number of those $0 premium plans available. So those are those blue states, and then increases in the availability of those $0 plans in those orange states. And, it's perhaps a little bit challenging to kind of keep track as we flip through maps year over year, but some trends in terms of, again, looking at, say, Texas, where we're seeing those increases in plans, and that's kind of shaking out in trend across a number of the different plan offerings. And then finally, just a quick look on the SNP side. I've gone too far. But what you would see on the SNP side is generally, similarly, increase in those $0 offerings in quite a number of states, which is pretty consistent with that increase in the offerings of special needs plans. So a lot to dig into as we look ahead into 2026, a lot of variation under some of these top line highlights, but we're going to be eagerly anticipating additional information and trying to understand enrollment trends for 2026 as we head into the new year.
Looks like we've been gifted a few more minutes than we expected. We could do ad hoc Q&A.
Sure.
Have you looked at the difference or the number of beneficiaries that are affected by the changes in the plans you're being offered year over year versus just the plan offerings by state?
Yeah, so I think your question here is trying to understand how many beneficiaries are impacted by these changes.
Because if they go ahead and they offer 10 plans, but it only affects 20 people, that really doesn't matter.
Yep. Nope, that is an excellent question, one that was top of mind for us as well. We've done some preliminary trying to understand of that as we look at straight plan terminations, but the crosswalk file, which kind of allows us to see those shifts year over year and kind of understand, well, is that just a plan being consolidated? Is it going away? Like, what does this actually mean if you're thinking about it from a beneficiary point of view? We don't have yet. So I would say stay tuned. That is a question we too are eager to see the answer to.
There's some other analytic files too that haven't come out yet. we haven't received the full plan benefit package files. So looking under the hood on what's really happening in all those PBP filings. Today, we were scheduled to get formulary and pharmacy network files. I don't think we're going to receive those because of the shutdown. And then of course we don't know who's enrolling in what yet, and that's the real deal. Is after AEP comes to a close, where did bennies migrate to, and looking at that after action on the enrollment files.
Other questions?
Jenny.
Sure.
As we look at, the raising Medicare Part B, right, going from $170 something to almost $300. As we're looking at the Medicare Part B increases, do you think that's going to allow more MA plans to offer, maybe not the $0, but give them a little bit more availability to still look like the good bargain for seniors as far as the complexity of care?
Just to clarify, you're talking about the Part B premium?
Yeah, the Part B.
Okay.
Yeah.
Some plans have always provided Part B premium reduction as a benefit. It's something that each plan has to decide on how they want to use their AB rebate dollars to buy down things. Generally speaking, most plans put first and foremost buying down that Part D premium. But some do the Part B premium. As Part B premiums continue to increase, I think more MA plans will consider that as an option to present value. You already know everything, Mike, so why are you asking questions?
I have a real easy question. In terms of the plans that are passing out, now I know you don't have all the 2026 data yet, but in terms of some of the consolidation in individual plans in recent past years, are there any generalizations you'd make about the plans that have passed out of existence with respect to high enrollment, low enrollment, or high stars, low stars, or any other inferences or generalizations you could make?
You want to start?
Sure. I think there is a number, like you point out, of things that one could look at there. I think something that I've been particularly keeping an eye out is region of country. And trying to understand, what kind of county, which counties, what areas are we continuing to see that expansion versus where are there perhaps challenges? We can't tell that from just kind of what we have, but, it has struck my eye that, some of the rural areas are places where, we are seeing some consolidation or perhaps fewer options compared to some of the urban areas. Mark, curious what you would add there.
I think from a business perspective, you look at plans that are struggling across markets. So they're struggling in the marketplace, Medicaid managed care, commercial, and then they're also struggling in Medicare Advantage. Those plans in particular are definitely reducing footprint. I think we're seeing a shift from PPOs to HMOs. I think we're seeing in general, if you go back 3-4 years ago, there was still a long trend of people being very aggressive in terms of growth geographically. And plans are looking at, where have they been successful? Where do they have a good provider network? Where are they being successful in stars? And those are the places they're staying. And if they're in a geography where they're struggling, they're considering scaling back that footprint. I think we got time for maybe one more quick question. All right.
All right. Well, thank you all.